Give your eyes a break.
Cody, I know when you say yes, it has. I know, my friend, that you've been watching a lot of television and shows, and so have I. We're all guilty of it, right? Well, good morning to all of you. This morning, we're joined by a VSP Network doctor, Dr. Jennifer Wademan, and she is going to go over the signs of eye strain from watching all of those devices and looking at them, and then also ways to combat it. So good morning to you.
Good morning. Good to be on here.
Thank you so much for being with us. Okay, so tell me, if you're a parent and your kid's on a device a lot and they probably aren't very vocal about eye strain and what they're going through, what are some of the signs and symptoms that you can look out for?
Good question, because kids often don't really have that self-regulation to necessarily stop when they're on a device or a tablet. But some of the things you can look for are, tired eyes. If your child's complaining that they're just tired, they're rubbing their eyes a lot. Sometimes too, just dry eyes. And so you'll notice that by, red eyes, or even their eyes kind of watering more often. Headaches can also be a common symptom.
Okay, so I know, at least in my case, getting off of my computer is not an option. We're all doing it virtually these days with all the Zoom conferences and education-based learning as well. So what are some things we can do if we have to be on our devices to just kind of help reduce the eye strain as much as possible, make it more comfortable?
Definitely. Device use is kind of unavoidable right now, but one of my favorite things that I tell my patients, my best advice, is something called the 20-20-20 rule. So every 20 minutes, take 20 seconds and look 20 feet away. Just relaxes your eye muscles. It gets your eyes kind of out of focusing up close. Another good thing that I tell my patients is just keep a good distance between your eyes and your computer. So usually I say about arm's distance is a good, comfortable distance to keep your screen. Another thing too is just dim the brightness on your devices. A lot of times glare is what causes, the discomfort, eye strain, and the eye fatigue. And so dimming that can definitely help. Another thing I like to use, and I tell my patients to consider, are glasses with a blue light filtering lens and anti-glare, just to reduce some of that blue light coming into the eye. And then also too, now as we're getting into different phases, within different counties here, to schedule an eye exam and to, if you're having symptoms, if you're having any problems, just to sit down and discuss it with your eye doctor. And then that way we can kind of tailor, the best need for your eyes.
Yeah, and I know a lot of optometrists and different eye doctor locations are finally starting to reopen. I know you yourself in Folsom, you're finally reopening. Are you seeing that you have to kind of do things a lot differently now with the sanitation and everything else with your appointments?
Oh my gosh, yes. I mean, we've completely, just adopted new safety protocols, new procedures, wearing masks, gloves, taking temperatures upon arrival, and limiting the number of patients we have in our office. So I often joke with my patients that I think it's probably more safe to see us than some of the other things, grocery stores and all those other places, just because we're, myself, along with other optometrists and healthcare providers, are really trying to make it safe for patients and our staff.
Yeah, for sure. Well, Dr. Jennifer Wademan, thank you so much. And next half hour, you're going to come back and you're going to talk about sanitizing your glasses so that the coronavirus bug doesn't live on a surface close to your eyes. So stay with us, guys. We're going to talk more with the doctor coming up in the 8 o'clock hour. Back over.